Hi, everyone. This is Dr. Nemechek again with another of our popular episodes, Viewers' Questions Answered. Just remember, if you have other questions you'd like me to answer, add them in the comments. I'll answer them there directly. And if they're interesting, I'll answer them in more detail on next week's post. And also, hit subscribe. Helps move us up in the algorithms for other people to find our material. First, I want to give my child glutamine. Can I do a full dose just once a day? It's tough in the morning when everybody's in a rush. I understand. I probably really can't fully appreciate if you have a couple kids, one's autistic, and you got to dose everybody with everything. The problem is glutamine doesn't work once a day. It just really, I've tons of experience with this. We use this a lot in the early HIV days before we had therapy. It just doesn't work once a day. So it's just for 6 weeks. You just got to tough it out, make it a priority, and then you'll be done. And because if you do it just once a day, you won't know. I mean, you may leave some gains on the table there for your child that you could have benefited from. So it's got to be twice a day. On social media, I came across a few parents of nonverbal children with autism who noticed their kids suddenly began speaking a few words and even meaningful sentences while being treated with amoxicillin for an infection. Does this mean the drug might work similarly to rifaximin in addressing SIBO? Yes, but with limitations. That was this observation that led to Dr. Feingold's paper in the year 2000, where he deduced that autism could not be a genetic phenomena because things like this happen. And he even treated 11 kids there for a couple weeks with a regimen to balance their intestinal tract and documented dramatic improvements in most of those children. Now, in adults, if you use amoxicillin, you might get in terms of balancing SIBO, you might get 20 or 30% response rate. Okay. The problem with autism is the kids relapse very quickly, and you have to maintain them on amoxicillin, okay, or whatever. But the problem with amoxicillin is there's a very high rate of resistance development, and within probably 4 to 6 weeks, it won't be useful at all for balancing the intestinal bacteria. That's where the rifaximin is so useful. Rifaximin resistance is incredibly rare and pretty much restricted just to extremely ill people in the intensive care unit. Okay? So that's why we're although it's hard to get rifaximin, you can still, if you can find a provider, you get it through Canadian mail order pharmacy. It's affordable that way, and it is stable. It'll control the bacteria for years if you need it that long. Okay? Good observation, though. How do I control my histamine problem while waiting for my leaky gut to be fixed or repaired? So when you have leaky gut, so histamine comes from mast cells. They're a type of white blood cell. About 70% of all your white blood cells, including your mast cells, are wrapped right around the small intestine. So if you get a little leak, you're going to trigger these mast cells and release histamine. So they're wondering, there's certain drugs to stabilize mast cells, block histamine, and blah, blah, blah. What do we do in that place? Well, I don't bother with that at all, because they've shown with both using rifaximin for SIBO and glutamine for the COVID enteropathy that within a week, those inflammatory chemicals, including histamine, are already dropping. So it's not a long process. The gut heals very fast. The enterocytes that make up that barrier, they're the fastest replicating cells in the body. They divide every 4 days, which is like incredibly fast. And that means they are the fastest healing cells in the body. Okay? So unless somebody is just overtly like in hives at the moment, I might say, go take some Benadryl or some histamine or something, or here's a few days of steroids if they're really that severe. And then we're just waiting for the week or two to get the leaky gut healed, and then the histamine symptoms just start melting away over the following few weeks. So you really don't need to do much in that regard. Regarding Midodrine, if I have a limited amount and I give it to my son in the morning before school, is it necessary to also give it in the afternoon since he's with me and not at school anymore? Okay, what they're talking about here is the children with autism have incredibly low blood pressure in their brain. It makes them anxious, hyper, aggressive, fearful. They can't focus. They can't learn. It's hard to pay attention, all from low blood pressure. And Midodrine is a drug used commonly in cardiology to boost blood pressure. Okay, so you can help the brain. The pressure gives the brain more oxygen and the kids calm down. Now, so you give it in the morning, it'll last about 6 hours. And so lots of times that may get you through the school day, depending on the circumstances. And we generally give it in the morning and then around 1 or 2 in the afternoon. But if you don't have enough, I would agree, probably in the morning, so that the school situation where he's trying to learn and so forth and socialize and all of that is more productive. I would agree that that's probably the best thing to do until you can maybe get a greater supply. Good question. Thank you. Does VNS have to be spread out through the day, or can I do 1 hour of VNS at night and get the benefits I need? Yeah, you can just do it all at one time, with one exception. If you're just doing 5 minutes as a little inflammatory hit, you want to spread that out kind of like you would if you were taking ibuprofen. Okay, so some people with bad arthritis are doing 5, 2 or 3 times a day. That works much better than 15 at one time. Now, if it's for central nervous system recovery, you can bulk it. You can do it all at one time. I had some severe issues many years ago. I'm presently, I require about 2 hours of VNS a day, and I do it all at once. I enjoy cooking, so I come home. I'll make a martini for Jean and I put my VNS on. I just start cooking, and we have dinner. We might watch a little TV while I've got my VNS on. I've never had a sense in all these years that if you split it up, it somehow made things better. We looked at that a number of years ago, and we couldn't tell it made a difference. So all at once is fine, unless you're doing those 5-minute increments. All right. And lastly, hi. Well, when do we start VNS? Well, I've seen many gains over the past 12 months with my 6-year-old using inulin, fish oil, and olive oil. He has not improved in speech at all. Should I start VNS or glutamine? In the second edition book, as well as the first, basically fish oil, olive oil, inulin, or fish oil, olive oil, rifaximin. You're going along, things are getting better, and in the 5 things I look at: socialization, emotional regulation, receptive language, expressive language, and blood pressure regulation. That's like hyperactivity. If all 5 are getting better, you don't need anything else. If 4 of the 5 are getting better, so like everything's getting better, but in this case, speech is not. The book says add VNS. Now, since what we've learned in COVID in the last 2 years, and this is going to be in the 3rd edition of the book that we're presently working on. It probably won't be out for 6 or 7 months, but this is going to be in the 3rd edition. All the kids, even my adult patients, get 6 weeks of twice-a-day glutamine, okay? The COVID gut damage, or what we call COVID enteropathy, that we believe is the primary mechanism for long COVID, this worsening symptoms, is very common. So I just, as a blanket statement, everybody needs it once and make sure they don't have this. So that would be the first place I would start here. And then you give it 2 months, 3 months, speech is not better, then you would invest in the vagal stimulator, okay? But you might be shocked. It could be that's all you need is the glutamine, and boom, you're off to the races. The speech is coming along. You now don't have to spend the money and all the time to be doing the VNS in the future. Well, that's all for today. Everybody, thank you very much for all your feedback you've been giving me. It's been very helpful. And till next week, this is Dr. Nemechek saying, take care of your kids, take care of yourself, keep your inflammation down, and have a nice weekend.